this presentation is going to be about nutrition considerations in gastrointestinal cancers. We're going to talk about cancer prevention and then also survivorship care of this population. So throughout the presentation, you may hear me refer to gastrointestinal cancer as GI cancer. It's just a shortened version. But my name's Sarah, and I am the registered dietitian for our amazing gastrointestinal medical oncologists and also our surgical oncologists. So I see all of our patients that are at all levels of care that are being treated for gastrointestinal cancer. So for our objectives today, I would love for everyone to take away from this presentation the ability to use nutrition really as a tool for the healing process. These patients have undergone months, if not years, of treatment, whether it's chemo, radiation, surgery, and now that they're in their survivorship phase, it's time to recover, heal, and focus on prevention. So today we're going to talk about how nutrition can play a role in treating lingering symptoms of cancer treatment. We're going to talk about how to address any potential vitamin and mineral deficiencies that were caused by the cancer or caused by the treatment or the surgery. And just understand how good nutrition and a healthy lifestyle can optimize the survivorship period and then also promote cancer prevention in the future. So the types of cancer that we're going to talk about, there are so many different gastrointestinal cancers. These are the major ones that we're seeing at the Perlmutter Cancer Center: esophageal, we'll go from top to bottom, esophageal, gastric, pancreatic, gallbladder, cholangiocarcinoma, hepatocellular or liver, small intestine, or neuroendocrine, and colorectal. So first, let's discuss how to address any lingering post-treatment symptoms that patients are highly likely to experience even after they finish treatment. Likely they've been experiencing this throughout treatment, but it does take some time to recover after everything's said and done. So definitely addressing these symptoms first will set patients up for just a good way to like focus on their nutrition so that nothing's impacting how they're eating. So the symptoms that we're going to talk about, like the cancers, there are many. So there's nausea, diarrhea and dumping syndrome, early satiety, anorexia, weight loss, and constipation. And so the thing that we want to drive home with each of these is how can you really hit back at these symptoms through your food and nutrition and using those things as tools. So first, let's talk about nausea. We really see this in all of the populations. It can be related to treatment. It can also come from surgery. And it's that sort of queasiness that people feel. And people can describe it as like an upset stomach or a sour stomach. So some nutrition tools that we can use and implement that are very helpful. Ginger products is one of the main ones. Ginger just promotes good digestion. It signals the bowels to keep everything moving in the right way. So I often will recommend cooking with ginger, using ginger tea, ginger chews, or even raw ginger sliced in hot water with lemon and honey. Those are very soothing to the stomach, and it just can mitigate any nausea and promote bowel motility the way that we want it. I often don't usually recommend ginger ale or like bubbly drinks, just because patients are going to be more sensitive to that gas that enters in when we're drinking carbonated beverages. If you like ginger ale, I would choose a diet, but then also maybe let it sit out, open it and let it fizzle out for about 10 minutes. And then with nausea, we want to avoid very high fat foods and fried foods. These kinds of foods are going to slow down our digestion. And so when we have something like fried foods or something that's very high in fat, like a lot of baked goods hanging out in our stomach, we're more likely to get that nausea. And then when we are feeling that queasiness, sticking to more plain seasoning so nothing is irritating the GI system. And then really thinking about what else is going on. Definitely, we are more likely to get nauseous if we are feeling constipated or we're sort of backed up. When we're constipated, our bowels aren't moving the right way. So things are backing up into our stomach, and we're starting to get that queasiness feeling. So if we treat the constipation, sometimes that can help relieve the nausea as well. And so diarrhea, very common in GI cancer. We can see it through any of the chemo treatments, radiation, or just simply from the cancer itself. So we define diarrhea as frequent loose stools. Sometimes they can be urgent in nature, and sometimes they can be painful. One thing that I'll start with is, what is the cause of the diarrhea? Where is it coming from? For our patients in the colorectal population, often they have to get radiation therapy, and so it does cause some irritation to that lower bowel, and their bowel movements can be more painful and very urgent. So I often advise people to avoid those irritating foods, those foods that aren't going to mix well with our bowels, specifically very spicy foods with a lot of pepper, like red pepper or black pepper. Caffeine or colas can be a GI irritant, and foods that are very rough, which we'll talk more about. So the big ones are going to be large amounts of whole nuts and seeds, or something like popcorn. Those are very rough foods, and they just might cause some irritation going down. And then often tomato or acidic products, so like orange juice or a large amount of acidic fruits, those can also be irritating to this population and promote more frequent bowel movements, which is not what we want. And then alcohol is definitely going to be a GI irritant as well. And so when the diarrhea or your loose stools are more so coming from the treatment, they're more frequent in nature, it's a good idea to focus on foods that are going to slow those bowel movements down and not speed them up. So often foods that are lower in insoluble fiber, fiber that promotes bowel motility and to push things along, we want to focus on decreasing the insoluble fiber, and we'll talk about how to do that. So sort of think like more soft foods that you can mash with a fork, like very well-cooked vegetables, fruits without a peel. Blended fruits and vegetables are always going to be great because they're already sort of half digested, and so you can by blending foods like that, it gives patients an opportunity to expand their diet a little bit more. By throwing anything like in the blender, it can usually go down in a pretty tolerable way. And then during this time, usually we like to promote whole grains, but during this time, it can be good to sort of switch gears and focus on more refined grains while you're experiencing this. They're easier to break down. They are going to be lower in fiber and a little bit less rough than the whole grain counterparts. So things like white rice, white potatoes without skin, white pasta, those are going to be very good and easy moving through and can slow down our bowel movements. And then nuts and seeds in butter form, like peanut butter. And then think brat diet. Think when you were younger and your mom told you about the brat diet, that's something that we can implement here. Bananas, rice, applesauce, toast, all of those can bind our stool and slow those bowel movements down. And sometimes patients, especially in our gastric population, even in pancreatic and gallbladder, they can experience this. They can experience something called dumping syndrome, where specific foods and drinks can just run way too quickly through their system, and it can cause them to feel nauseous, dizzy, and have that diarrhea. These kinds of foods are mainly going to be things that are very concentrated in sugar, so like fruit juices, sugar-sweetened beverages like the Starbucks Frappuccino, energy drinks, sweet teas. Those are going to be things that just run too quickly through the digestive system and can cause diarrhea. So best to avoid during that time. And then similarly with the fried foods, it causes, like eating those fried foods can just cause the stomach to dump everything into the small intestine too quickly, and we get that diarrhea. So best to avoid those things. And then one of our first pro tips of the night, a good way to deal with your loose stools or diarrhea is to focus on soluble fiber. So fiber that can help bind your stool and gel it. So one of a great tool is actually psyllium fiber. So it can be in a powder form, and you can mix it into applesauce or even just some water, and it can act as a gelling agent. So that's super helpful for some of my patients. And then along the same lines as psyllium fiber, cooked and cooled. So you cook the white rice or the potatoes and cool them in the fridge. That acts as a resistant starch and can also help gel the stool and slow those bowel movements down. And same thing with marshmallows. That's more for our patients that have ileostomies or colostomies, but those can even, that with people that don't, it can be very helpful to slow the bowel movements down. And lastly, we definitely want to monitor our bowel movements for any things that look off. Discoloration, that can definitely tell us a lot. If our bowel movements are light brown or pale, orange or gray, this is going to be somewhat common in the pancreatic population, but can also be seen in gallbladder, esophageal, gastric. It's going to be showing up as more malabsorption as to why they're having these loose stools, especially if they've undergone surgery. They can often experience this pancreatic insufficiency where their pancreas isn't producing enough of the enzymes to break down their food so that they don't get diarrhea, or there's misalignment. So where the enzymes are going where the food has already left. So then we get that malabsorption and these weird colors. So definitely keeping an eye out for that. And if you do notice that, definitely bring it up to your doctor or dietitian so that they can recommend if you need digestive enzymes. And if you are already on digestive enzymes to help break down your food, making sure that you're taking them with the first bite of your meal. And the more fat and protein that you're including, we want to have more of those digestive enzymes available to act on that food. Early satiety, people will often just feel very full quickly. They take a couple of bites and then they're done eating. So a good way to counteract this is to eat smaller, more frequent portions. So small mini meals or snack-sized meals every 3 to 4 hours. And then focus on foods that are going to take up less space in your digestive system. Cooked vegetables and soft fruits instead of raw because they're going to take less time to break down. Separate eating and drinking, so not chugging a bunch of water while you're trying to eat your meal. It's okay to sip, but really try to wait at least like 15 to 20 minutes before and after your meal to drink the majority of your fluid for hydration. The water is just going to take up space in your stomach or your digestive tract, and you're just not going to have enough room for the actual calorie-containing foods. And then along that same line, avoiding things like juices and carbonated beverages because they're just going to take up that space as well and not really give us any nutrition. And then chewing food well, just to make sure that it's already broken down by the time that it gets down to the stomach or the digestive tract, so that it takes less time and things can move through a little bit quicker. We don't want food to stick around to make us full. And then including a high protein bedtime snack can often be useful for people who are experiencing early satiety, something like a banana with peanut butter, or cheese and crackers, a handful of nuts, something like that, just to give a little extra protein at the end of the day, but they're not going to feel too full from it. Anorexia, or having just no appetite, very little hunger cues. We see this in all of our patients really at some point or another. They feel like they have to force themselves to eat, and this can last even after treatment is done. And so patients often say, like, I'm not eating because I don't feel hungry. It is a difficult situation, and hopefully the appetite will soon come back, but for the time being, while you're recovering, nutrition or eating often requires what I like to call prescriptive eating. So more so eating by the clock rather than an appetite or a hunger cue. So eating every 3 hours, making a point of it, or setting a reminder on your phone to go off every 3 hours, having external reminders, such as like if you're watching Netflix and the next episode comes on, before you watch the next episode, let's think about having a snack or a shake. And then trying to optimize movement as much as possible because this will definitely help stimulate the appetite. And then weight loss, we do see this a lot, specifically in the GI population due to all of these things that we just talked about. Unintentional weight loss, where they are continuing to lose weight without trying. Really, during this time, we have to focus on foods that are going to pack a punch, focusing on very high calorie, high protein foods that aren't too much volume, so you can eat more of them. Good examples are like cheeses, sour cream, so adding cheese to your vegetables, adding additional olive oil to your grains, your pasta, adding whole fat Greek yogurt or sour cream onto the potatoes, and then avocado in soups. All of those foods pack a lot of calories, but it's only going to be a small volume. So making sure that all of our meals and snacks include something like that. And then making high calorie shakes to have in between meals can be very useful. And again, using light exercise to rebuild that muscle mass that may have been lost previously. And just being very mindful of your symptoms, of what you're still experiencing, even if it's after you finished your treatment. Monitor what's still going on with your body. Are you continuing to have diarrhea or discolored stools? That could be an indication that you're not absorbing all of your nutrients. And this definitely needs to be addressed in order for weight gain to come. Yeah, so definitely monitoring what's still going on and addressing it with your doctor. And then lastly, constipation. This is extremely common in not just GI cancer, but everyone. So we do see it in a lot of GI cancers, sometimes related to treatment, often not drinking enough fluid. So constipation, we're going to see those small pebble-like stools and stools that are harder to pass. So the first thing that we need to make sure of is that we're drinking enough fluid. It can be water, it can be coconut water, decaf tea or coffee, a rehydration drink, but we need at least 80 ounces of fluid a day, and if not more than that. We need fluid in so that our guts can promote motility and can keep things moving in the right direction. If they don't have that fluid, they're going to be slower and just not as active. And so things that can kickstart your digestion, especially in the morning, to help you have a bowel movement, having a warm beverage or warm cereal, like oatmeal, coffee, tea, that can be very stimulating. And then also including things such as ground fiber. So like flaxseed or psyllium comes back. It can also help with constipation. It helps move things along. And then more recent research has actually shown that 2 kiwis in the morning can work as well as some stool softeners and work just as well as something like prunes or prune juice. So that's just another tool, another delicious tool to have. And then really keeping up with your activity, even just getting up out of the chair and walking around every couple of minutes really can help stimulate movement in our bowels. And then often this is definitely an issue in the United States. Our toilets are too high. So we can benefit from being in more of like a squatting position. So thinking about using a toilet stool if having that bowel movement daily is very hard to pass. And next, we are going to talk about some potential vitamin and mineral deficiencies that can come about from the GI cancer itself or from the subsequent treatment. And so just disclaimer, do not start taking supplements without first speaking with your doctor or dietitian for guidance. You should take these under supervision because there are so many supplements out there. We want to make sure that they're appropriate for you and if they're even needed. Over-supplementation can be harmful and have unwanted adverse effects. So we definitely want to be very careful but it is good to be aware of vitamins and minerals that you could potentially be at risk for deficiency. So number one, vitamin D. Most people are going to be deficient in vitamin D, especially where we are in New York City, in the Northeast. We aren't getting a lot of sunlight, especially in the winter. So many of us are going to be deficient in vitamin D. It is essential for bone health, like we probably all know, but we're finding out more and more that it's pretty much essential for a ton of functions in our body. So we're finding out that the cells in our body do have a lot of vitamin D receptors. Therefore, cell health is going to be linked to vitamin D status. So definitely getting these levels checked at least yearly by your primary care or your oncologist. And vitamin D sufficiency is going to be important for cancer prevention, especially in our colorectal population. There has been links found with insufficient vitamin D status and increased risk for colorectal cancer. So just monitoring that and making sure we're either taking a supplement to try to get it to normal, and also always focusing on good sources of vitamin D. As you can see on the lower left, mushrooms are great, eggs, salmon, sardines, milk. Those are all going to be very powerful sources of vitamin D. Number one source is going to be the sun. So just 20 minutes of sunlight in the morning when the UV isn't as harmful, so usually that's going to be before 10 a.m., can meet your vitamin D needs for the day. So just a good overall lifestyle habit to think about incorporating: a daily walk in the morning. That can help replenish your vitamin D stores, and also just add to your physical activity count for the day. Vitamin D's cousin, calcium. As we age and we get older, our bodies need more calcium to support our bones, our teeth, and our muscle functioning. If you are older than the age of 75 or postmenopausal, you may need calcium supplements. So definitely discussing that with your doctor as well. You also could need a calcium supplement if you don't include a lot of dairy in your diet. Dairy is going to be one of the bigger sources, but we can also find it in our green leafy vegetables, which are good to include. And with our patients who have experienced or have had to have a total or partial gastrectomy, they are going to need lifelong supplementation of vitamin D and calcium and some additional vitamins, which we'll talk about in a second. For our patients that have undergone specific hormone therapy, such as our neuroendocrine population, they are also at greater risk for calcium deficiency and more bone mineral loss. So also a good idea to talk to your doctor about this and see if any bone mineral density scans are appropriate. And then just to get an extra boost of calcium, an easy way is to just add some green leafy vegetables into a smoothie or a soup, that is just a great way to pack an extra punch of calcium. Iron and vitamin B12, like a lot of our patients have noticed throughout their treatment, they do see some drop in their blood cell counts, and that is caused by the chemotherapy. So to sort of recover from that, we definitely want to make sure that we're eating enough protein and also monitoring our iron levels. So along with The vitamin D, asking to get an iron panel, which includes vitamin B12, at least yearly with your oncologist or your primary care physician. Definitely, patients who are going to be at increased risk for iron deficiency or vitamin B12 deficiency are gastrectomy patients, specifically with vitamin B12, people who have undergone bowel resection and have an ileostomy or a colostomy, and also our patients who have undergone the Whipple or pancreatectomy can be at higher risk. But really, most of our patients in the GI population are going to be at higher risk, at least for iron deficiency. And so sometimes we do need a supplement. So if an iron supplement is indicated, again, by your doctor, trying to take that iron supplement away from any calcium-containing foods. So think like trying to take it away from any dairy products, because iron and calcium can inhibit their absorption of one another. So it's best to take iron on an empty stomach, preferably with a vitamin C source, like a small glass of orange juice or a little cup of potatoes, something like that, because vitamin C will help us absorb iron better and more efficiently. So zinc is sometimes a deficiency that we see, especially with our patients who have been experiencing prolonged diarrhea or prolonged taste and smell changes. Sometimes the taste and smell changes can be caused by the specific chemotherapy that they're receiving, but if it's for a prolonged period of time and it's after you've finished chemo and you're in your survivorship phase and you're still having these weird taste changes, things taste off, it could be a good idea to get your zinc levels checked, because zinc deficiency can cause altered taste or dysgeusia. Zinc is definitely going to be important for our immunity and skin health, and its deficiency can cause a delay in healing. So if after surgery, if you're not on the chemotherapy, it could be a good idea to take something like zinc with vitamin C, but definitely doing so under the guidance of your doctor or dietitian. With our patients that have an ileostomy or colostomy, if they're having very high output, very loose output all the time, they can be at higher risk for a zinc deficiency. But noting for, I know some people love to take zinc pretty frequently. Zinc supplementation is only meant to be short term. The recommendation is only for 2 weeks of a specific dose. And no longer, because if we are consistently taking zinc for a long period of time, we can give ourselves a copper deficiency, which we don't want. But zinc is going to be in a lot of our seafood, specifically shrimp, oysters, pumpkin seeds, and oats as well. And then vitamin B6. So this is a newer one that we've been focusing on, more so with our patients that have prolonged peripheral neuropathy that has been chemo-induced. Sometimes we see that if they are vitamin B6 deficient, it can worsen or prolong the neuropathy. So we have been working closely with the oncology rehabilitation program to provide these patients nutrition education about these specific vitamins and making sure that they're eating enough of the good sources. But if you're experiencing this, it could be a good idea to bring it up to your oncologist that you've been having prolonged neuropathy. I'm sure that they're aware, but having those labs checked along with vitamin B12, vitamin D, and magnesium can all help reduce the neuropathy a little bit. And patients who are at increased risk for vitamin B6 deficiency are those who have had some sort of small bowel resection, and then those that have an ileostomy or colostomy, so that their digestive tracts aren't fully connected. And definitely, like we've said previously, taking vitamin B6 under the supervision of a dietitian or a doctor, because excess can cause nausea and other gastrointestinal issues, which we do not want. And good sources are going to be your tuna fish, chickpeas, potatoes, and bananas. And so lastly, magnesium and potassium, two very necessary electrolytes that keep our bodies functioning. Low levels of both can be a result from excess diarrhea or not eating or hydrating enough. Low levels of these electrolytes can cause fatigue, muscle weakness, cramping, and often we see it's likely because it's very hard to hydrate properly for some patients. So during that time where it is more difficult, a oral rehydration solution or an electrolyte drink could be useful during that time. But eventually we would want to practice hydrating so that we can go back to simply just using water and eating well. But good sources of magnesium are going to be almonds, leafy greens, pumpkin seeds, nut butters, black beans, and then potassium we have bananas, avocado, potatoes, oranges, and then green leafy vegetables as well. And so another pro tip, coconut water is a great natural rehydration beverage and a good natural source of potassium. So if you are choosing a rehydration drink, definitely your dietitian can give you a good recommendation, but look for those that have lower amounts of added sugar. And so our last section, how to include more plants in your diet for cancer prevention. Likely many of my patients have heard me say this when they get a phone call from me for their survivorship consult, is we love to recommend eating the rainbow. And what does this really mean? And why should we do this? Eating the rainbow means including the widest variety of plants in your diet as possible. Therefore, if you're including the widest variety of plants, you're getting the widest variety of colors that the plants give us. These colors or phytonutrients are antioxidants. They give the plant their color. These substances are really going to be what protect our cells from damage and what is going to help us prevent cancer. And so by eating a wider variety of color means that we get the largest array of cancer protecting agents. So if we are incorporating tomatoes for red, oranges for orange, bell peppers for yellow, all of our green leafy vegetables, blueberries for blue, eggplant for purple, etc. You get the gist. Then we're getting all of those colors. If we're only including green vegetables, then we're only getting those antioxidants that specifically come from the green color. And we're not getting as wide of an array as we would if we ate all of the different colors. So a good tip on how to try to include more plants in your diet and focus on more of a plant-based diet is what I like to call the 1-2-3 rule. So including 1 fruit or vegetable for breakfast, including 2 new fruits and vegetables for lunch, so a fruit or vegetable that you didn't have for breakfast, and then including 3 new ones for dinner. That will give you 7 different plants a day. 7 times 7, 49. We have a lot of variety there. So a lot of different opportunities to get those good antioxidants that are going to protect our cells. And so like we've seen previously in this presentation, is it can be very difficult for this population to eat a wide variety of plant foods during and even post-treatment. Sometimes it is harder for patients to tolerate very high fiber foods from whole grains, a lot of vegetables, fruits, legumes, beans, either due to ongoing diarrhea where they're focusing on those lower roughage foods, or because of altered anatomy from their surgery. Their gut is still recovering and adapting, and it can be a little bit more difficult to tolerate those high fiber, very fibrous foods. So what I recommend is trying to avoid excluding any, like a whole, like saying like I can't eat like this specific fruit or vegetable. Seeing how you can decrease the roughage of the food that you're trying to eat instead of completely avoiding it. So instead of completely avoiding berries, trying to blend them into a smoothie. Or if salad greens are very difficult, same thing, adding them to your smoothies and making a very nutrient-dense drink. You're still going to be getting all of those antioxidants as if you were eating them raw or cooked. Making hearty soups and stews with soft vegetables, so vegetables that, again, you can mash with a fork. Cooking those vegetables down so that they can be easily mashed with a fork. I just said that. And then choosing dips or nut butter. So like choosing eggplant dip or sunflower seed butter. Those are definitely going to be easier to digest, and you're still getting that wide variety of antioxidants if you're hitting all of these points. And then as you recover and you get farther away from the chemotherapy, radiation, or surgery, start slowly with small portions of higher fiber foods, very, very small. See how you do with them. And if it doesn't work for that one time, revisit it in a couple weeks and try again. And so then we can just start slowly building up our repertoire of plants that we're able to tolerate well. And then we can't knock eating behaviors. Eating behaviors are extremely important when we're trying to tolerate these higher fiber foods. We need to chew them very well. Eat slowly and avoid any distractions while we're eating our meal. This allows our digestive system just a better chance to actually digest our food. And so what foods should I avoid to decrease my cancer risk? Avoiding foods that are classified as carcinogenic or could cause cancer, according to the National Cancer Institute. The biggest one specifically for our population is going to be processed red meats, hot dog, bacon, sausage. deli meats, we really want to try to avoid these as much as possible. If it's a special occasion, once in a while, that's okay, but really just trying to not have it be in our day-to-day or week-to-week lifestyle. These are shown, the processed meats are definitely shown to be linked to GI cancer, specifically colorectal cancer. Large amounts of artificial sweeteners, so choosing more natural beverages as we're able to, like the coconut water, teas, flavored waters with fruit, etc. Large amounts of red meat, and red meat is classified as beef, lamb, or pork. It's okay to include once in a while, but again, week-to-week lifestyle, try not to have it be an everyday thing. Charred meats, so meats that have a blackened or burned shell, basically, those are also carcinogenic. So wanting more so to focus on baking our proteins, using the air fryer, sauteing, things like that, so we're not burning the outside. And then fried foods, trying to limit our fried foods as well. And just to round out this presentation, some additional survivorship points. Physical activity, like we've been honing in on, trying to get at least 30 minutes of movement a day. It doesn't have to be going to the gym. It can be walking, climbing the stairs, stationary biking, jogging, swimming, whatever you like to do, or even for those of us that live in New York City, getting off the subway a couple of stops early and walking those extra blocks just is a good way to get movement in. And then rounding out our good lifestyle behaviors, we have physical activity, we have our nutrition, quitting smoking if you do, limiting alcohol to 1 drink a day for women and 2 drinks a day for men. And then something that I would like to talk about, avoid weight cycling. So sometimes a big thing in cancer prevention is we say maintain a healthy weight. It is best to focus on just the nutrition, physical activity, smoking, and alcohol, trying to get those down first and not focusing on the weight to where you're trying a bunch of different diets to get the weight down that are not able to be maintained long term. When we're not able to maintain a specific diet, then that weight that we may have lost from the diet sort of comes back twofold, and we can end up gaining more weight than we previously had started with. And that is also not associated with great things. So focusing on your lifestyle and making sure you're able to do these specific 4 things, and just focusing on your nutrition and all of the things that we discussed, trying to follow more of a plant-based diet. And we are always here to support our patients and our families. We have a lot of great resources at the Perlmutter Cancer Center. And so always feel free to ask for what you need to achieve this good lifestyle. If you are having difficulty swallowing your food, depending on what it is related to, like if it's from esophageal cancer, any head and neck cancer, definitely letting your doctor know. But then also a speech language pathologist can be useful to decide or to help you figure out what consistency is right, whether it's pureed, or if you need more thickened liquids, you can still have a texture modified diet and have it still be nutrient dense and follow the things that we've talked about in this presentation. Anti-inflammatory is a good thing to focus on. We want to decrease any inflammation that is going on in our bodies, and good foods to focus on for anti-inflammatory are going to be our foods that are high in omega-3 fatty acids. So our fatty fish, walnuts, avocado, olive oil, edamame, beans, all of these things have very good anti-inflammatory fats. So having those be sort of a good center of your diet, but then also trying to pull back on things that may be a little bit more inflammatory, like the processed meats, the red meats, artificial sweeteners, things like that. Reflux, definitely, and we didn't have time to touch on this, but that's definitely going to be a big symptom in our population. Something that can be very helpful is ginger. So if you're having the reflux up here, sometimes using the ginger chews specifically can really help mitigate that reflux, along with avoiding things that are known to be triggers for the reflux, such as large meals, alcohol, very high fat foods, pepper, more acidic foods like tomato products. Nuts definitely are going to have more fat. I would probably try to limit the portion to, like, for peanut butter, like a tablespoon or less a day, and then maybe just a small handful of nuts and chewing them very well so that they are able to go down a little bit easier and not have that trigger to reflux up. This is a very up-and-coming thing. Let's talk about green powders first. Green powders, I would say, when we go back to trying to eat the rainbow, trying to eat the widest variety of plants as possible. Sometimes with green powders, patients or just the general population can think that they are a replacement for those plants that we need. And often they're going to be at very high doses of each vitamin. And really, we don't need that in such high doses. Often, if we're not using it, we're going to excrete it or pee it out. So I don't love the green powders, but I would, it would be definitely a case-by-case basis specific to the patient. And then probiotics. So this is definitely patient-specific. A lot of research and talk and discussion in the GI world is coming about the microbiome and probiotics. Definitely it depends on the patient, but we can always focus on good probiotic-rich foods. So Greek yogurt, sauerkraut, miso, kimchi, refrigerated pickles, cottage cheese with added probiotics. Those are going to be very helpful and a good idea to include in our diet on a day-to-day basis because it just helps create a healthy microbiome. Sometimes people do need probiotics, but it definitely is not a one-size-fits-all recommendation.